Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, attorney Kim Hegwood of Your Legacy Legal Care, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and our very special guest today is Dr. Elaine Eshbaugh. Good morning.
Good morning.
I'm super excited because you're a professor of gerontology and family studies. So, it's always nice to have, the doctors in the house, and so to speak. And today we're going to talk about empowering dementia care. And so you have done a lot of work in this area. So we're going to get some good stuff for our listeners today. And so your work emphasizes a strength-based approach to dementia care. Can you talk to us about, focusing on what remains rather than what's lost, the changes the caregiver experience has for families, that kind of stuff?
Yeah, absolutely. And I guess what I would say about that strength-based approach is that I really think we should all approach ourselves and everyone in our lives from a strengths-based approach, simply because there's so much negativity in this world, and unless you intentionally are looking for that positivity. So I really take that approach to families in general, and not just those living with dementia. But I do want to say, even though I talk about having a strengths-based approach, you do get to grieve that you are losing part of your loved one. So someone who is living with dementia, I know it's easier said than done to always focus on the positive. And I just want families to understand that it is very valid that, you may realize that maybe you're celebrating holidays this year with kind of a different person than you did last year. Your loved one is changing, and it's okay to react to those changes. That being said, I also find that the connection and the joy of our lives is when we focus on what is with us in the moment rather than what maybe we've had in the past. So that's kind of where I'm coming from when I talk about that strengths-based perspective. And I'm definitely not a Pollyanna, because I know this is hard, and dementia is, dementia can be a really devastating condition, and it's really difficult. So I'm by no means denying that.
And the old saying is sometimes you'd rather laugh than cry.
Absolutely. And the thing is, you can do them both at the same time. I've learned you don't have to choose.
And always good. So that's always good. And so you founded the University of Northern Iowa Dementia Simulation House. How's that for a nice long name? And
It
so,
is.
and what inspired this project, and how does it help caregivers and professionals, really better understand the lived experience of dementia?
Yeah, so we do call it the DemSim House around campus. So just to shorten that up a little bit. So what inspired this project? I'm a college professor, and I have realized over time, and this is not just true of college students, that, I can tell somebody something a lot of times and it doesn't really stick. But when you go through something where I give you an experience, that tends to stick. And that's a more effective way to educate a lot of populations. So I've really delved into this idea of simulation, and we are not the only people who do dementia simulation. However, we are the only people who do it in a whole house setting. So there are other people who will do dementia simulation, and they may bring gear to a nursing home room or to a hospital room, and they may show staff, say, what it's like to live with dementia. And that's wonderful. And I 100% support that. However, what we acknowledge is that 4 out of 5 people with dementia do live in their own homes. So for us to have a whole home at the university that we're able to devote to this is really big, because most people with dementia are doing the same things that we are all doing. We're getting up in the morning and, we're trying to find something for breakfast. We're making our coffee. We're trying to clean up as we go and get our laundry done. And so those things are still doable for many people who are living with dementia, except there's just an extra level of challenge. And that's one of the things that we try to teach people about. It helps caregivers and professionals better understand the experience, just that we tend to sometimes think dementia is just about memory loss, and dementia is brain failure. And we have heart failure, we have liver failure, we have lung failure, and all of those things happen slowly, gradually over time. And this is really no different. So this is a part of your body. It's an organ that unfortunately is failing you. But while it is not always performing as you would want it to, there are certain strategies that you can use if you're someone living with dementia to try to help you to accomplish those tasks that you always used to do and to enjoy the things that you always used to enjoy. And that's one of the things that we really focus on is, we want you to understand what it's like to live with dementia. And we want you to also understand that people with dementia have tremendous capacity to do amazing things, but sometimes we have to help to set them up for success. So we have at the house the 3 E's. We say empathy, education, and empowerment. So we want you to empathize with those who are living with dementia. We want to educate you about these changes and what you can do to support people who are going through these changes. And really the big one is empowerment. So we want you to be able to step into the world and empower caregivers and those who are living with dementia. So we have people who come through the DemSim house and maybe they don't have a loved one who is living with dementia. Maybe they're not really close to anyone with dementia. And for them, it may be a matter of, say, being more patient when you go to the grocery store. For instance, when there's someone in line who needs a little bit of extra support and time and just not rushing and maybe being able to assist them. So we really just want to build a more dementia-friendly community. And that is for those of us who live with dementia, those of us who are caregivers, and those of us who just live in the community and support those people.
So validation therapy is central to your philosophy. Could you explain what it looks like in practice and why stepping into the world of someone with dementia is so powerful? I mean, I've seen where you do the video, where you put the VR, the headset on, and do the simulation like you have dementia. I just keep thinking, man, I'd like to
Yeah.
actually be in the house. Do you know what I mean? Because I think that would be really,
Yeah.
really powerful.
And that's an important distinction you make, because there are some people who use VR to show you virtual reality to show you what it might be like to live with dementia. And that's actually a little bit different from what we do. So that's a valuable experience that other people do where you put on the gear and you look around, using this gear as a person living with dementia. But what we're actually doing, to clarify, is we put you in the house and you have goggles, headphones, and gloves. And all of those help you simulate a few minutes in the life of someone who's living with dementia. So we're going to ask you to do some tasks. We're going to ask you to, maybe vacuum. We might ask you to make your bed with this gear on that simulates what it might be like to live with dementia, because dementia changes how you experience the world. So it changes how you experience the information coming in from your 5 senses. And we're going to simulate not smell and taste, because people probably wouldn't send their friends, but we do simulate the changes in the other, in those other senses. So validation therapy is something that we use now for individuals living with dementia, and not just individuals living with dementia, but others as well, where we support people where they are at in the moment. So the alternative was when I was a child of an activities director at a nursing home in like the late 80s. And she was taught to do what we call reality orientation. And with reality orientation, what that really means is we remind people firmly and gently of who they are and where they are and what year it is and what season it is and even what day of the week it is. So that would be if someone who has dementia is wandering around and their husband has passed away 10 years ago and they look for their husband. And they're looking for that husband who maybe passed of cancer. If they're looking for that person and they say, hey, have you seen my husband? If I'm doing reality orientation, what I'm going to say is, hey, your husband passed away 10 years ago from cancer. Well, I see the look on your face.
No.
So the problem with that is that if they had the capacity to remember that their husband had passed away, they wouldn't have asked me where their husband is in the first place, right? Mm-hmm. So an alternative to that is to step into their world and validate where they're at. So they're living in a world where their husband has not passed away. So I'm going to step into that world. So they might say, hey, do you know where my husband is? He was supposed to be here and he's not here. Well, I actually live in Iowa, and I live in Waterloo, Cedar Falls area, which is the headquarters of John Deere Tractors. And we have a lot of older gentlemen here who work for John Deere. So, an answer we might give someone would be something like, oh, well, he's working second shift at John Deere tonight, or he's working, he's had to stay late at John Deere at the factory or something like that. Oh, shoot. Okay. But then I'm going to go a step further, when we talk about validation therapy. And that's something that maybe something we add on to the end in the way that I teach my students and I teach the people who come through the house is that I'm going to ask you, so why are you looking for your husband? And maybe there's a need that I can meet. So maybe they're going to say something like, well, I wanted to see if he wanted to get a cup of coffee. Well, I'm not your husband, but I could get a cup of coffee with you, and then I might sit down and I might say, tell me about your husband. And I might just listen. So validation therapy really meets people where they are at. So we hone into this idea of connect, don't correct. And we find that the joy is oftentimes in that connection. And I don't care who you are. I don't care if you're right or wrong. No one really likes to be corrected. And when you correct somebody, it's really hard to correct them and then connect with them. So we focus on that connection rather than correcting them to their reality, because keeping in mind their reality is just as real to them as your reality is to you.
Caregivers often juggle jobs, family, emotional stress, so what strategies do you recommend for caregivers to find that joy and resilience in the midst of all these challenges?
That's a great question. And I think it's different for everyone. Different strategies are going to work for different people. And quite honestly, when it comes to dementia is about change. So what worked last week may not even work this week for you and your loved one living with dementia. But one thing I always stress is that you can't compare your loved one who has dementia to who they used to be. You have to meet them where they are in that particular moment. And I know that's really difficult for family members because you see someone who used to be, very accomplished and they were very career oriented and they won a lot of awards. And now you're looking at someone who it's an accomplishment, maybe if they can just brush their teeth. Well, it's important that you celebrate that accomplishment of them brushing their teeth. And I know that can sometimes be really difficult, a really difficult shift of the mind. Changing your expectations is really important, and also just letting go somewhat of who that person was. So that isn't to say that you didn't love and appreciate your mother for who she was throughout her lifespan, but you can still love and appreciate who she was, but let go of that and allow room to be with the person that she is right now in the moment. And let go of the expectations that you have of that moment. And I think in the holidays in particular, that can be really difficult. And I always talk about how it is okay to let go of your family rituals. It is okay to not have Christmas or Thanksgiving or Hanukkah in the same way that you had it last year. It is going to look different. And that's okay. That doesn't mean that there can't be joy in it, but just acknowledging that change is okay and change is inevitable.
So you've spoken nationally about dementia misconceptions. So what are the most common myths you encounter, and how do they impact the way families and communities respond to dementia care today?
Yeah, so that's a great question. The two big myths that I focus on a lot. First of all, people think this is just about old people, and it's not. It's really not just about old people. Unfortunately, there are types of dementia that do impact children. They're rare, but not rare enough. There are people who are impacted by dementia when they're in their late 30s, their 40s, their 50s, and that is, that's young adult in our world today. So people think, oh, this is just about old people, and that's just statistically not the case. So if you look overall at people living with dementia, 10% of them are under the age of 65, and even 65 is really not that old. So this is not just about people who are who are moving toward the end of life. This is striking people who are in the prime of their lives. Another thing that we try to educate people on is that this is not just about memory loss. So dementia is, I said earlier, it's brain failure. So just like you have heart failure, you have liver failure, this is brain failure. And it happens very slowly, very gradually, and also very unpredictably over time. So you have people who may have dementia, and they may show some symptoms maybe earlier in the disease process that people don't identify as dementia. So for instance, impulse control problems. Impulse control issues in certain types of dementia early in the process are very, very common. Like if you have a frontal temporal dementia, It's common for those individuals to say and do things that we perceive as inappropriate. We might, for men, sometimes we perceive it as having, say, midlife crisis. So he's saying something inappropriate to the neighbor, or he made this really weird purchase. He bought a boat and we don't have a lake or a river to even put this boat in. And those can very much be signs of dementia. So trying to change that narrative. So this is not just about, oh, people get forgetful and people get confused. Because when I ask people, hey, this is brain failure, what does your brain control? The answer really is everything. So it's very individual how this disease is going to impact those who are impacted.
So humor plays a role in your approach. We talked about that early. And so how can laughter and lightness coexist with the seriousness of dementia care? And what benefits do you see when caregivers embrace it?
So I've always thought, I've always been that person who thinks everything is funny, and sometimes it gets me in trouble, right? But I do also think it's kind of my superpower. So I can find humor in just about anything. And I think when caregivers give themselves permission to find humor in situations, life gets a lot easier. I think that there's a distinction between laughing at someone who has dementia and finding humor in a situation. And I'm actually really sensitive about that because, dementia is not any funnier than cancer or any other disease, but it is something that sets you up in a lot of situations that wow, if you really, take a moment and think about what's going on, like you said before, sometimes you have to laugh or cry, or sometimes you very you very often can do both at the same time. So, I think also keeping in mind that that most people who are living with dementia, when possible, they want to maintain that sense of humor as well and laugh with you about sometimes situations that dementia can create that can be kind of silly or ridiculous. But at the same time, keeping in mind that, people with dementia, what is happening to them is very real in that moment, and not laughing when they're not laughing, if that makes sense at all. So I think there's a link we sometimes don't really give enough credit to between dementia and anxiety. It can be very anxiety provoking to live in a world that doesn't make sense. So there are a lot of hard emotions that come along with dementia, but I don't think there's any reason that hard emotions can't also incorporate humor, as well. So when we talk about caregiving, I think one of the first things that I find is, we have a support group of caregivers, and one of the things that has amazed me in the 3 years that we've had this support group every week, one thing that has amazed me is how much they laugh. And I think one of the important things about our support group is that they give each other permission to laugh at the situations that sometimes they find themselves in, and laughing with each other, and also laughing along with the people who are living with dementia. So I always think, as a caregiver, humor can very much be your superpower.
I think too that humor releases the better things in your brain that makes it easier, so
100%.
so it kind of releases some of that cortisol stress that you hear about all the time, to make your life easier. So this has been fantastic. So Dr. Eshbaugh, if somebody wants to find you, how do they find you?
Well, you can drop me an email. My email address is Dr. Eshbaugh, DRESH, B as in boy, AUGH, @gmail.com. Or you can also find my website at elaineeshbaugh.org. So that's ELAINE ESHB as in boy, AUGH.org. I do sometimes do speaking engagements, and I do have a blog as well. And that blog is called When Dementia Knocks. And you can find that through the link at the website as well, or just Google When Dementia Knocks, and it will typically come up.
So do you allow people, outsiders to maybe come in as a group to do the dementia house?
Yeah, so the Dementia Simulation House is open to the public. It is free to everyone. So we actually have a website. If you were to just Google University of Northern Iowa Dementia Simulation House, you would find our website. And you can go to our website and you can click a time, kind of like you would maybe book a haircut. You can book for 2 or for 3 or a dinner reservation. So you can do that. If you have a group of 3 or more and you want to set up a specific time for that group to come, we can work with you to try to find a time as well. We do employee training. So some senior care facilities will come and they'll bring, maybe a group of 12 or so, and we can do that simulation and do a training with them. So we're always happy to have interest from various groups, and it's not always the groups that people would expect. So, for instance, we recently trained a group of electricians because they were having problems when they would go into someone's home to do work, and they would be there for a while, and then the person would forget why they were there and think they had broken into the home. So we do trainings with hairstylists because obviously people with dementia need to get their hair done. So what is that experience like as a person living with dementia? So this is really a community-based project. So we want caregivers to come. We want people who work in senior care and who work directly with those living with dementia to come. But keeping in mind, people with dementia are out in our communities doing the same things the rest of us are. So restaurants, retail stores, we love to train your employees so that they can just be a little bit more dementia friendly. When people with dementia might take advantage of the services that you offer.
Perfect. Thanks so much. This has been
Absolutely.
enormous amounts of great information, and we look forward to having you again on the show soon.
That would be lovely.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.